Hi guys, I'm Danny West and you're back with another episode of The Soapbox, your patient education station. And we are continuing our conversation of physio first aid and chatting about the hip this week. So what happens if you kind of tweak your hip? And I'm talking about, especially with dancers, they'll kind of like flare, maybe they'll tweak their hip flexor a little bit. So they start to get pain in through the front of the hip. Either maybe one side or maybe both sides. So what can you start doing if that starts to get a little cranky? So the first thing you can do is a little counterintuitive, but I don't want you to stretch it, okay? So again, if we stretch an already ticked off hip flexor, it can flare it even more. So I say avoid things like, for example, if it was your right one that you kind of tweaked, avoid say left splits, because that's going to put your back leg, your right leg, into that stretched position. We're going to avoid maybe arabesques with the right leg, and even any deep lunges where the right leg is the back leg, because again, that's going to kind of stretch out that hip flexor and kind of risk taking it off. So it's a little bit counterintuitive, but try to avoid stretching it, especially if it's what we call acute. So we don't mean adorable, okay? Acute in physio language means it's fresh, it just happened. It's within 7 to 10 days of it being injured, okay? So avoid stretching until you at least go see someone and get it checked out. The second thing is you can actually start doing bridges. So bridging, again, I'm not talking about an acro bridge here. I'm talking about a really simple physio style of bridge. So I'll demo it real quick, but again, by recruiting the glutes, it actually helps inhibit the hip flexors in through the front, okay? So you're gonna lay on your back, pushing through the heels, bridge the hips up, hold for 3 breaths, and then slowly lower. And again, engage the glutes, bridge up. I don't care how high you go, it's just to turn on the butt. And then relax, okay? So again, I might do that, couple sets of 10 on repeat throughout the day. The third thing that I would do is release the back and the side of the hip. So a lot of the time, if the glutes are really tight, or what I call the bad hip flexor, which is TFL, so it's the little muscular part of your IT band, kind of right in the side of the hip, those two probably need a little love, and they can actually be restricting the front of the hip if those two are really tight. So there is a soapbox on this in particular. It's called tips, ball and tips for the hips, but I'll kind of review them real quick right now. So the first one we want to target is glute med. So it's kind of the upper side of the butt cheek, okay? Kind of right above where a jean pocket would be. The second one is TFL. So if you find your hip bone, slide out and down an inch. It's that little gushy tender bit right in there. So tennis ball is a good kind of consistency. Find a golf ball is just too hard. Some people use lacrosse balls or pinky balls. Those are all good. So again, we're not actually gonna roll with it. We're actually gonna find a little trigger point and see if we can just relax over it. So the first one we'll do is glute med, followed by TFL. So, glute med, lay on your back, tennis ball on that upper butt cheek, and then you're just gonna tip your hips to the right and just see if you can release over it. Once it feels like it's dissipating, you can come off. You can check TFL. So hip bone, slide out and down an inch. This one you'll know when you find it. And you might have to rock your hips forward a little bit. And just kind of holding and breathing. Okay, so those two are my go-tos for a cranky hip flexor or front of the hip, okay? In terms of modifications, do bar work, okay? It probably won't like high kicks or anything above 90 degrees. So if there's any cranky kind of hip flexor front of the hip, I say just avoid grand battements below 90, or like keep them below 90. No, nothing higher than that. That includes like grand jetés, would be like basically a grand battement in the air. It won't like développés, so again, maybe just instead of développing to retirer, just développer to coupe and extend out. So keeping them relatively that leg low to the ground. And then when it's a supporting leg, really thinking about pulling up out of the supporting leg so you don't kind of sit in that hip, okay? But keeping things low, especially for the affected side, and avoiding any positions that would stretch the front of the hip, especially in those first kind of 7 to 10 days, and especially if it's not calming down, okay? So those are my tips for the hip. Bridging, tennis ball for sure, and then your modifications is just going easy on it, okay? A scab is not gonna heal if you keep picking at it, so quit ticking it off. And the nicer you are to it sooner, the hope is that it will dissipate quicker instead of you picking the scab and it lasting forever, okay? And then the last final thing that I like to leave people with is the ping pong trick, okay? And this is from Dave Lindsay at the UFC. He has said, Danny, you can spread the word about ping pong. So what ping pong is, and the way I understand it, is a deep kind of recruitment in the hip. So you have your hip in the socket, okay? And we want it to load nicely right in the center of the socket. When those deep rotators, and I'm talking they are super deep, they're close to the bone, not the glutes, okay? Dancers, these are your deep turnout muscles. If those take a holiday, which usually if your hip is cranky, they have, and that's why it's not working properly, it kind of like just won't load nicely in the socket, okay? And so we want to try to resolve that as quickly and as efficiently as we can. So the first type of training is called ping pong. So you basically sit kind of on a floor or a firmer chair so you can feel your sits bones. And you're gonna picture a ping pong ball on the inside of your right sits bone. And I want you to move it over to the inside of the left sits bone, okay? So you're basically doing this with an imaginary ping pong ball on the insides of your sits bones. And notice I'm not saying grip your whole butt cheek, okay? So this is very deep, very specific. And also the contraction has a little directional cue. So it's trying to go towards midline. It's not just squeezing my butt and then just kind of jumping up, okay? It's this deep directional contraction towards midline. And guess what? It takes some freaking practice. And when I first teach people, they're like, what the hell are you talking about, okay? So it takes some practice, but you can start to do it in seated. And then the whole idea is we need to be able to recruit things when we're upright, okay? Life happens in upright, not in seated, hopefully. So again, we need to start practicing that contraction seated, especially if you have a cranky hip. And then we start to apply it, okay, now can we start doing that little contraction as we walk? So as you step on the right foot, the right ping pong should contract, and as soon as we step on the left, left ping pong. Right ping pong, left ping pong, right ping pong, left ping pong. And it's this little deep butt contraction that again, start with in seated. And that's what you can start to do because we need to wake up those deep ones because they've probably taken a holiday if your hip's cranky to begin with. And if that went right over your head, don't worry about it. Start with the bridging and the tennis ball. But that would be something that we would be training in clinic. Is how can we get the deep stabilizers to work and do their job? Because clearly the big ones are cranky and taking over, okay? The episode on the core, also excellent. Again, if that hip flexor is cranky, it comes down to poor core control. So look up my Fab 4 for the core, and I would get started on those as well, because those I use as a test in clinic. So if I'm seeing you in a couple of weeks for a cranky hip, expect to be tested on those, okay? That's your fast physio first aid for the hip. And again, just to tie it over until you see someone in clinic, by no means is it meant to replace a proper assessment, okay? That's the soapbox for today, guys. Thanks, and happy ping-ponging.